Good morning. I can't even believe what a hot mess I am today. And here I'm with you live. We're going to be talking about the immune system and how to keep yourself prepared. And I've had a really interesting morning so far. And I am going to show you this little picture that a patient showed me yesterday. I'm going to see, could it show up there? This is like a really great trajectory of, your life plan right there. And then this is kind of what happens, right? So that's what happened to me this morning. So I'm Dr. Jenny Tufenkian, and anything I say today is not necessarily medical advice. It's just information you can talk to your provider about. So what happened with me is that I was really excited about coming to you guys' Facebook Live, and I had this whole plan this morning. I was going to meditate and then feed my kid and walk the dog and then come in and do some practice runs and do all this other work around filming and that kind of stuff. I was really excited about it. But I woke up this morning not feeling well. I'm actually got really bad pain going on in my shoulder. My phone completely broke and wasn't working. I figured I could do this on my computer, but of course it's not charged. So, and then I have a couple of urgent patient situations that I really need my phone for. So long story short, I am here with you now and very much live and putting this all together, and I can't wait to share this with you. So one of the things that I love about this little outline is, it's really not about this trajectory. It's really about what we do with the squiggles, right? And the squiggles are kind of like, if we talk about the immune system, it's getting sick. You don't usually plan on getting sick. So one of the things that I love to do is actually have stuff on hand so that if I am beginning to not feel well, I've got stuff. Like for me this morning, I actually woke up with diarrhea and nausea. And so I did a little brain-mind thing that I do that I'll show you before we leave today. And I also took a whole bunch of probiotics. I downed like 4 to 6 PB Assists today to help my gut get healed up. And I also was able to see somebody today, and I learned something new that I'm going to share with you, which is sometimes in Chinese medicine, the colon can be holding on to things that, whoopsie, can you guys even hear me? I realized that my headphones, it's just one of those days. I realized that my speaker was here, not even attached to my body. It's just one of those days, I'm telling you. Please let me know if you're here. I'd love to hear from you, and let me know if you have any questions. So back to again, that releasing things from your digestive system is a way of the colon holds on to like old griefs and old kind of dark energy, and sometimes when you're going through a transition, part of it, that process is just releasing it. There's always something good to come out of being sick. That's my theory. So what I love to have on hand are probiotics, and that's a really great thing to be taking all the time. Your gut associated lymphoid tissue, GALT, is in your digestive tract, and it needs to have really good probiotics. Probiotics are like the good guys in the neighborhood, and there's some bad guys that are in the neighborhood, and there can also be some sort of mediocre guys. And as long as you keep dosing yourself consistently with really healthy probiotics, then the good guys are going to win. So always keeping the probiotics going daily is really great. It's also really great to do like what I did, hey Sadie, is to be able to increase that dose, like up dose if you feel like you need it. So if I was around somebody, if like one of my kids was puking, I would start taking a lot of probiotics at the same time. Or like in my case today where I wasn't feeling so great, I really up dose. It's pretty hard to overdose on probiotics. If you take probiotics and you start feeling bloated or not feeling well with them, it may mean that you've got something else going on called dysbiosis. Hey Liz, something called dysbiosis. And if that's the case, then I really highly recommend you come in and see a naturopathic physician or a functional MD or nurse practitioner to get help with that. The other thing that I always have on hand are some really great immune supportive products. And doTERRA, I love On Guard. I use On Guard all the time. I use the drops. I take them internally. I also love the beadlets. I usually have a pack in my purse, mostly so that I can give them to the people I'm around. And then I love the caplets. And now I have the hand spray. If I'm traveling, I always take a couple of the beadlets or a capsule as prevention for travel. I also love to put the oil directly on my hands, but now we can use the hand spray. And that's great for children because, children, they kind of goober everywhere and they touch everything and then they stick their hands in their mucous membranes. And that's exactly how we get viruses this time of year, is we touch something, then we stick our finger somewhere on our face, and that's how we get it. So On Guard on the fingers is a great prevention. I have one thing to always remember about being ill is it's super, super uncomfortable. Whenever being sick creates this whole inflammatory process in your body, and that process does a number of things. First of all, that it kind of makes you feel yucky, so you actually lie in bed so you heal. And when you have that inflammatory cytokines being released throughout your body, it's actually sending chemical messengers to alert your immune system to ramp it up. So number one thing I would say is that if you actually do get sick, you really need to rest, because resting is allowing your body to actually heal. That kind of muscle achy feeling you get when you have a fever, that's your body breaking down your muscles so that it has free amino acids to actually go and fight the battle. And the reason you don't feel like eating is for the same reason. It's actually less energy for the body to destroy those muscles and use those amino acids to fight the battle than it is for your body to actually digest food. So eat really simply if you actually feel sick. There's a immune globulin that gets released when you're sick that makes you feel depressed. So has anybody out there ever gotten the flu and they're like convinced that they're never, ever, 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 ever going to get over it? Like life is just going to be like that forever. I know I've been there sometimes when I've been sick, and there's an immune globulin that if you inject that immune globulin in people who are healthy, they feel depressed. So know that part of that yucky, depressed feeling is part of your body's immune system functioning, and know you will get over it. But this is one of the places where I love to use the oils in a way that's not just for your immune system, but it's also for your emotional system. So using balance and lavender, I'm pointing down here at my table because I have them right in front of me. Using balance and lavender are great when you're feeling ill because they're just so soothing. And the lavender itself is actually antiviral, so that's really helpful. The other thing about when you feel like you're getting sick is you really don't, if you take things like medicines that are anti-inflammatories to bring the pain down, like something like Advil or Tylenol or one of those to bring a fever down, you're actually stopping your body's ability to fight that infection off properly. Now, there may be times when actually taking that kind of a medicine is important and helpful. And again, I'm not offering medical advice here. I'm just saying from a physiological perspective, what's going on when you get when your body spikes a fever is it triggers, again, this whole process in your body that allows the messengers to come on and do their job. It's kind of like if you have a national disaster and in a state, like when we had the fires here, and they call out the National Guards and like, hey, come help us from all the states all around. And then they get to the border and you take that Advil or that anti-inflammatory and they're like, oh, no, actually, sorry, we don't actually need the help. That's really what's going on there. You actually want your body to be responding once you get sick. I am going to give you some tricks, though, so you don't actually need to get there. So, first of all, if I feel like I'm coming down with something like I did, well, let me even back up from that. First of all, prevention, right? So healthy diet, chewing your food, this time of year, eating really well. If you feel like you're getting sick, get off the sugar, because that actually decreases your immune system by 40% for 4 to 6 hours after you eat sugar. So, all the On Guard beadlets in the world aren't going to necessarily be able to counteract that if you're just tanking on the sugar at the same time. So respect and love this gorgeous body that you live in and give it the food and the nutrients and the water and the rest that it needs so that it can do its job in protecting you from seasonal insults. I love to do this practice, and where if I feel like I'm coming down with something, I ask, do I actually want to get sick? Sometimes the answer is yes, and I'm sure some of you can relate to that. It's like your life is so freaking busy that actually being sick would be a great way to stop. Hey, Erica, would be a great way to stop. So I ask myself that question, and if the answer is yes, I think, can I get this need met in a different way? And often for me, it would be, I just really want to take a break. I need some time out, something like that. So I I make a deal with myself. I'm like, okay, if I take 4 hours this Saturday and I just go chill out, will that work? And usually the answer is yes. And then I ask, do I still want to get sick? Usually by then the answer is no. And then I do a practice where I say, I'm healthy physically, mental, emotionally, and spiritually. I'm healthy physically, mental, emotionally, and spiritually. And 9 times out of 10, that helps me just shift into a different place. And then along the same lines, I'm treating myself well. I'm eating really good foods. I'm taking some of these things that I'm talking about to support my system. The first time I did this was years ago. I was in the clinic, and it was at the end of the day, and I had a fever of 101. It was flu season. In my head, I'm already canceling out all of my patients for the week, just in my brain. I'm thinking about dog care, child care, trying to figure out how I'm going to manage it all. I drove into my driveway, I sat in the car, and I did this practice. I walked in the house, I sat down for dinner, I didn't say anything to my whole family. I talked to them, I'm sorry. I talked to them, I didn't explain to them that I wasn't feeling well, just didn't mention it. Went to bed, before I went to bed, I did it again. I woke up the next day, and I was fine. I was healthy. I didn't get sick. I didn't get sick that whole season. I really, really think that the best medicine we have is actually in our own bodies. It's in our subconscious mind. It's in our heart. It's who we are. That's the best medicine. And I really think that these natural oils support the process of our own natural being. We have this vital energy in us that wants to promote us into being a more healthy and vital place. And the essential oils and some of the vitamins and herbs and supplements we take just support us to get there to be able to radiate at a higher level and stay healthy. Let's see, what else did I want to say to you? I wanted to say to you that I think that I want to talk about when you are sick with a gastrointestinal illness. Most of you already know this, but I just need to say it. The biggest risk is dehydration. So please, please, please stay dehydrated. When my kid has a gastrointestinal thing, I make sure that he stays hydrated. And the best thing to do is to use a WHO formula or some sort of electrolyte solution. And if they're too nauseated to be able to drink down a whole glass, then just have them take a teaspoon every 5 minutes. It mostly just gets absorbed through the mucous membranes in the mouth, and not a lot goes to the stomach, so it doesn't really get that irritated. My favorite thing is with GI upset is actually Digest-Zen. Such a great combination. And I love it because you can ask the person who's ill, do you want to just smell this? Or do you want to just have it rubbed on your belly? Or do you want it on my feet? Again, I know my son, he usually just loves it on his belly if he's not feeling well. If he feels like he can handle it, he'll take something in your mouth. But you know how that is. If you're really sick with gut stuff, sometimes you just don't even want anything in your mouth. I really, it's just so important to just stay hydrated and to really keep that up. If somebody is dehydrated, an urgent sign of dehydration is something called tenting. So if you pinch the top of somebody's hand like this, and this top and the skin stays up, tented like in this shape, then that's a sign of very, very, very severe dehydration, and they need to get into an emergency room and get an IV of hydration. If you're out in the wilderness somewhere and you can't do that, then just keep doing the teaspoon every 5 minutes. There was somebody who was somewhere, a patient of mine, and she did that, and it was great. It really helped her a lot. One of the things that I love about this little picture about this life, the trajectory of our life, the life plan versus what actually happens in life here, is that I really think the thing that we can need to remember is that life is not so much, it's really about what we do in the squiggles, right? It's like the attitude that we have in the squiggles. Like myself this morning, I only gave you half of what was going on in my day today that has just not been quite flowy. And yet I am so grateful that I was able to find a place where I could actually laugh about it. And I ended up in the last minute needing to drive somewhere else this morning before I came here to see you guys. And I still was able to really appreciate the gorgeous trees and their beautiful fall colors right now. And I was driving on a street that I drove on a lot when I was a kid. I grew up in this area, and I just was like, wow, I've been like loving these trees in the fall for like 40 years. How cool is that? And I was just able to be very present in the moment. And I know that that is supporting my immune system right now. So that whatever this GI thing I've got going on is just going to go away in no time if it's not already gone now. So please remember to love you guys, and let me know if you have any questions. I will be on this Facebook group checking you guys, as I know some of you watch this later, and be answering any questions. Thank you so much for your time and attention, and please remember to love. Thank you so much.